Hey everyone, Ryan here from IKN. So in this video here, what we wanted to do was to explore the key biomechanical differences between the Spanish squat and the wall sit. Now the Spanish squat and the wall sit are two commonly used tasks to allow you to constrain demand into the knee extensors, into the quadriceps. But I'm sure we've all experienced a lot more challenge and demand through the knee extensors in the Spanish squat as compared to the wall sit. But why is that the case? So here, of course, we want to explore those biomechanical features that will inform us as to why the Spanish squat increases the demand on the knee extensors. So firstly, the tying of a belt or a rigid strap around the upper shank here that's fixed on an object in front allows you to stabilize the position of the shank, of the shin. And that then in turn gives you the opportunity to shift your center of mass, mainly your head, your arms, and your trunk, further behind the knee joint. And the knee joint is the axis of rotation that we're most interested in. So when you shift a lot of mass, like the head, arms, and trunk, which makes up 2/3 of your overall body mass, further behind the knee joint, that is going to increase the mass that is trying to create knee flexion. Okay, and so it's essentially going to increase what's known as the external knee flexion moment arm. And that's going to couple with the entry point of the ground reaction force that we'll explore in just a few moments. And that will all serve to increase, again, the external knee flexion moment arm, which is, again, the force that's trying to bend your knee, which means that you need to generate a greater internal knee extension moment to counteract that external moment, which is going to increase the demand on the knee extensors. But the key thing here that the head, arms, and trunk here is floating in space. So again, it's trying to pull, it's creating a downward force that's trying to pull the knee into flexion via the femur, okay? So that's another sidebar conversation that we'll have briefly at the end here, where it's important to consider when we're thinking about the motion and the force generation through a joint. We have to consider the segments that make up that joint. And when it comes to the knee, we're considering the shin, the tibia, and the femur. Of course, we have the patella there as well, but here we're going to look at the femur and the shin. So that center of mass shifted posteriorly pulls the knee into flexion via the femur. Okay, that's what's happening in more compound movements like a squat. In a knee extension machine, for example, you are not considering what the femur is doing, you're considering more what the shin is doing. So it's more of a shin dominant or tibial dominant strategy. Whereas here we have in a Spanish squat, the femur and the shin that are acting together to create more demand on the knee extensors. So combined with that posterior weight shift and that upright trunk, the key thing is you're keeping the trunk upright there as well. A common mistake that two mistakes that people will use. Firstly, they'll try and throw the shoulders forward, and that's going to bring the head, arms, and trunk, the mass of the head, arms, and trunk further over top of the knee joint, which is going to reduce the amount of load that's trying to bend that knee into flexion. So that's going to decrease the external knee flexion moment. Okay, so it's going to reduce the demand on the knee extensors. So it's key that you keep the trunk upright in the strategy. As a result of that the second mistake there is that you'll often see across YouTube the type of strap or band that clients or practitioners will use is not rigid enough. You need a rigid, robust strap to really stabilize and fix the position of the shin, because that will give you the confidence to shift everything posteriorly. You'll often see practitioners use a skinny resistance band that has a lot of give to it, a lot of yield to it. And so when you try to shift your center of mass backwards, the shin also gets pulled backwards as well, because there's not enough rigidity to the band. You don't want much give or yield to the band or the strap here. So that's mistake number 2. But what all this serves to give us the opportunity to do is to generate force down to the ground, not just down to the ground straight down, but also down and forward. So you're applying force down into the ground and forward. And that's the internal force that you're generating into the ground. And so the ground reaction force vector, which is shown here in red, is the external force that the ground exerts on you in response to the force that you're exerting on the ground. And that's why we have more of a, not a vertical direction or a vertical entry point of the ground reaction force vector, but it's entering the system in more of a horizontal manner. So it's entering further behind the knee joint. And when it enters in this direction here, this increases the moment arm, which is perpendicular to the ground reaction force vector. It increases the external knee flexion moment arm, which is going to increase the internal knee extension moment. So it's going to increase the knee extensor demand. Compare that to a air squat, for example, in open space, where you're just doing a normal squat. The entry point of the ground reaction force is going to be much more vertical there. So it's going to run almost parallel to the shin or slightly behind. And what that's going to do then as a result, it's going to reduce the knee extension moment arm. So it's going to reduce the demand on the knee extensors. It's not going to run parallel to the shin, but it will run slightly behind it, but not as far behind as you see here. So that's what the Spanish squat affords you the ability to do, is to shift the center of mass further backwards, but it allows you to really shift the entry point of that external ground reaction force vector into the system much farther behind the knee to increase the external knee flexion moment arm. So that entry point of the ground reaction force vector, combined with the fact that the head, arms, and trunk, which makes up 2/3 of your overall body mass, pulling the knee into greater flexion via the femur, combine to really increase the demand on the knee extensors. So now let's compare this to the wall sit. Now the wall sit has very similar kinematic features, which is the position of the segments, the joint angles. So we have a vertical shin, we have the knee at 90 degrees, we have a head, arms, and trunk that are positioned posterior to the knee joint. But the key difference here is the fact that the head, arms, and trunk, the center of mass, is stabilized against the wall. And what this does, it reduces that downward pulling action of the head, arms, and trunk to pull the femur down to create more knee flexion. That's not happening in a wall sit, okay? So you're not getting that extra demand on the knee extensors there. Now, you are getting a similar entry point of the ground reaction force, because you're not just applying force straight down into the ground, you're applying force down and forward, just like in the Spanish squat. But you're not getting that coupled action of the head, arms, and trunk pulling the knee into flexion. So we're still driving force down and forward. The entry point of the ground reaction force is still farther behind the knee. So it's still going to increase that external knee flexion moment arm as compared to something like an air squat. So you're still going to feel a lot of constrained demand into the knee extensors, but not as much as the Spanish squat. Okay, so that's the key difference there. You'll often see, and it's funny, once you understand the biomechanics here, you'll often see clients, athletes stacking up weight on their knees here to try and increase or make it seem like they're increasing the demand on the knee extensors here. But because the force is acting parallel to the shin, there's no real external knee flexion moment arm there. There's no force, external force, that's trying to pull that shin or to pull that knee into further flexion. So you could have anyone really stack up a lot of plates and weight on their knees in a wall sit, and it's not really going to increase the demand here. That's why you'll often see us in clients where we want to increase the demand here, but we haven't really progressed to a Spanish squat yet. We may place an external load like a kettlebell or a barbell that's loaded up in the hands underneath the head, arms, and trunk, because that's going to try to pull the head, arms, and trunk down the wall, which is going to add a little bit more demand into the knee extensors. What you could also do here and it's going to change the entry point of the force vector here and how you're applying force into the ground. But if you take a small step back to bring that shin from a vertical position to more of a forward angle position, what this will do now is it will increase the knee flexion angle, but now you're going to be applying force straight down into the ground. as opposed to down and forward. So it's going to allow you to experience a little bit more load and demand into the knee extensors, because now you're not pushing straight back into the wall, but it's going to add a bit more of a vertical force vector. But because now you've taken that shin from a vertical position to more of a forward angle, now that force vector is going to be further behind the knee. And so it's going to increase the knee extension demand. It's going to increase the challenge on the knee extensors. So it's really all about understanding how you're manipulating moment arms, how you're manipulating the kinematics here, and the direction of force, how you're driving force into the ground, and the resultant ground reaction force, the external ground reaction force that enters the system differently as a result of the force you're applying into the ground, because that's going to change how that's going to change the moment arm, the size of the moment arm on certain muscular tissues and joints. Okay, so hopefully that made sense. Again, I think it helps to have a greater understanding of the biomechanical features underpinning certain tasks, so that we're a bit more clear on how we're manipulating things, manipulating things to constrain demand into certain muscular tissues, but also gives us the opportunity to adjust and modify things if the client's not feeling it where they should feel it, or if the client's not experiencing that demand. Okay, so there's lots more videos coming like this. If you liked it, please let us know below. And like always, if you have any questions, please drop those below as well. Thanks for listening.